Thanks very much. Thank you very much for the opportunity to speak about this topic with the library. Thank you very much for that. We're working closer and closer together, even though we're apart, which is really nice. Thank you, everyone. And just to reiterate, I'd like to pay my respects to the traditional owners and custodians of the lands in which we're meeting today. I'm on Wurrung country, and country has never been ceded, so I pay my respects to elders past and present and emerging. I'd also like to acknowledge a great friend, a co-author of this presentation, sadly passed away late 2018, Dr. Paul Taylor. What a great guy, leader in research integrity. So he's co-author of this, my presentation, most of them actually, from now until eternity. We had a great bond, great working relationship, great friendship. So shout out to Paul. And I'd like to acknowledge the strange days, or the days we find ourselves in, acknowledgement of time, really, of past, present, and future. I was trying to situate this presentation, research integrity, in a pandemic. And initially, I think a lot of us in research integrity, or people in research ethics, struggle to think about, well, is anything really that different? And maybe it is. Maybe there are new needs. Maybe there are new stresses, new pressures. Maybe we're going to find ourselves in a new situation, very new situation for something that's so intrinsic to research. But this timeline is to situate the presentation, and I'll talk a little bit about things that preceded before today, or where we are now, and then at the end get a chance to talk about where we find ourselves as researchers, as research institutions, as the public interfacing with research, and maybe then horizons beyond that. Firstly, we'll start with the basics. What is research integrity and why is it important? There are many different perspectives and views on research integrity. Many people talk about things such as research fraud and misconduct, and limit perhaps conversations to those things, retractions and things like that. Breaches of research integrity, breaches of responsible research sort of limits the conversation. So I'd like to talk about research integrity in a way that many of us do in a more full way. And why it's important is probably obvious to the audience, but let's talk about it anyway. Again, with the basics, research generates and organizes knowledge by the systematic investigation and study of materials and sources. The value and positive impact of research is dependent on trust, and upholding the principles of research integrity make research trustworthy. So they underpin trust in research. So using this definition, then calling out principles, research integrity is the coherent and consistent sticking to or adherence to a set of principles that are characteristic of responsible and ethical research and underpin the trustworthiness of research, our trust in it. This definition is set, or really frames the idea of research integrity around the principles. So principles, and the value of these principles is trust in research and realizing the value of and positive impact of research. There are different ways of doing this, of course, of defining research integrity, but this seems to be a common one since about 2010, since it was realized you could develop quite straightforward policy for potentially all research and articulate research integrity and trust around a simple set of principles. And indeed, that's what's happened in Australia relatively recently for guidance or policy or codes that come out from the NHMRC and the ARC. And in this case, also with Universities Australia. They were co-authors of this document, the Australian Code for the Responsible Conduct of Research. You'll see there it says 2018, really came into effect in 2019. And what this document is really based or framed around these a set of principles, 8 principles that this document describes as the hallmarks of, an honest and ethical, conscientious research culture that sort of underpin and then inform practices for researchers and institutions, but arguably many different parties involved in the research endeavour, not least of which are funders and sponsors and agencies such as the NHMRC and ARC. Here are the principles of the Australian Code. You'll see that in Australian English, we use responsible research. Here they've used responsible research conduct. These are terms that are interchangeable with the term research integrity, we find, less so with interchangeable with the term research ethics. And here they are here. It's worthwhile just going through them really quickly. Honesty, rigor, transparency, fairness, respect, recognition, accountability, and promotion. Here are the pillars, the things, the foundations for essentially research, for the intrinsic components of research conduct, of communicating research, planning and designing, administrating research as an institution, supporting researchers in the research endeavour. So we also know that these principles are translated into practice by human beings, and these human beings are working in a very complex system of expectations, of traditions. There isn't a lot of work, research, looking at this. It's a nascent field looking at essentially research integrity and the mechanisms that affect maybe the behaviour or the conduct of researchers or even institutions. But what evidence there is, what research has been conducted suggests that the mechanisms that modify this translation include levels of experience of researchers, researchers starting out versus established researchers. There's very interesting research coming out of the Netherlands looking at personality traits and how they can affect this translation. There are conventions followed by research disciplines that end up making the translation of certain types of research practices such as authorship very, very different when you compare, say, for example, disciplines across chemistry as compared to art history. Authorship is quite different, related to the way of doing research, way of knowing. And then recent evidence is suggesting research environments where research is conducted is really important too, a mechanism that affects this translation of principles into practice. So this calls out a really important role for RMIT. It calls out a really important role for the various actors within RMIT who are often described as the institution to support and promote and facilitate responsible, trustworthy, ethical research. So all of these factors end up generating this variation, a variation in the translation of principles of research integrity into research practice by researchers. And again, there's not a lot of evidence, but say that we have enough evidence to establish that there is variation, and we can define something of a spectrum built up of boundaries. So researchers will act or conduct or behave in certain ways when they're doing research, informed by all these factors, and there'll be variability. So on one side of the spectrum is responsible, trustworthy research. We say then that these principles here from the Australian Code, like honesty and rigour, are not only essential foundation necessary for the foundation of research, but also they inform research excellence or high quality research. And then there are blurry boundaries describing this departure away from these principles, where in the middle band of the spectrum, you see practices that are often described as questionable research practices. These are kind of mundane, commonplace practices that are due to error or sloppiness, and maybe some of them only exist for, maybe some people argue, positive results. So these things span the boundary between blurry thresholds, but boundaries between what are called breaches of research integrity, and then also serious breaches of research integrity, the other end, the opposite end of the principles, where the principles are not met. These are fairly well understood at the very far end, things such as fabrication, so the making up the complete fictions shown in research, not research really, but then also falsification, which is related but different, and then also things such as plagiarism. And plagiarism is quite an interesting one because it spans what you could say it spans the entire spectrum from serious breach to being almost acceptable. It's very interesting for us. We know some data, and this is situating this talk probably, in the 2010s, 2015, some data. Most of the data here, the percentages here, are data derived from surveys and analyses of surveys of mostly US researchers who are mostly from biomedical research backgrounds. So these data have lots of caveats against them, but these surveys suggest that these questionable research practices or serious breaches of research integrity can occur at quite high rates. These numbers represent either self-reported surveys or surveys where researchers report on the conduct of their colleagues and asking around, have you done plagiarism within the last 3 years, or have your colleagues falsified, or have they modified data in the last 3 years? These kind of answers, these kind of questions. And so you see these proportions that you could say that serious breaches of research integrity occur, according to the surveys, at relatively or unexpectedly high rates. But the middle band of the spectrum is where there's a lot of action. There's a lot of things happening. So why is research integrity, or I suppose research integrity, make it trustworthy? They are the foundation for research excellence, so they inform high quality research. The definition we provided and had a look at today allows us to recognise and address the entire spectrum of research practice, including breaches and these blurry thresholds from where there are departures away from principles or principles are not met. Research integrity and the principles underpin the positive impact of research and mitigate diverse risks for individuals and institutions. And research integrity enables this public trust and also this social license that we have, or institutions have, and us as researchers have, to undertake academic research inquiry and to make new discoveries and to generate knowledge. So there's a brief pause here to just check in and see, Sam, perhaps if there are any questions, or if anyone would like to ask a question for the front end.
Yeah, thanks, Daniel. I haven't got any specific questions so far in the chat, but yeah, just quickly, if anyone wanted to put their hand up or jump in with a question, please do. Otherwise, I think we can hand back to you.
Fantastic. Everyone completely agrees. Wonderful. That's great. So let's talk about where we are now, where we are in the current state of the pandemic. What does this look like? Well, for research, compared to, say, the SARS outbreak in early 2013, roughly, I think, or 2003, there's a lot more papers being published about COVID-19. In fact, these data suggest that there's been an explosion of papers very recently about, so a lot of research being communicated about COVID-19 since the first documented paper that was published in late January. And this has just all happened in the last 8 months or so, that there's over 45,000 papers. Many of these research publications or communications are being communicated and disseminated using preprint servers. So in platforms where there's no peer review, and some of them are very well established, some of them have been going on for a long time and developed through discipline need for the more rapid dissemination of communication of research, and a well-trusted sources. But these are still is a different way of communicating as compared to, say, the traditional submit for peer review, change to peer review, and revise, and then finally publish, and going through cycles of that. So this is very interesting. There's been a relative explosion, an explosion in terms of interest in publication and research being done on COVID-19 and the pandemic. This isn't just all about the biology of the virus or epidemiology of public health. There's a range of topics that are being explored by researchers across the world. So when we first arrived at the pandemic and there were restrictions put in place, some aspects of research were obviously changed. Some ways of conducting research were all of a sudden disrupted in a big way. Methodologies had to change, etc. You couldn't do certain types of research, we couldn't go in, we couldn't leave the house. So there was no way of actually doing research to particular types. But there was this reflection then after that, a relatively slow one compared to all the rapid things that happened, especially at the very first few months of the pandemic, particularly for research integrity. Some of these things are questions that require a bit of thought and are kind of slow. And that's one of the changes that's happened. A lot of research that is slow has sped up or has been replaced by rapid research. So the fairly basic questions: what are the needs for trustworthy research during the pandemic, during the setting of rapid and large-scale communication? How have research practices changed? Because some of them have changed profoundly. Some research practices, RMIT is supportive of trying to get them to occur if they have to occur wherever possible. But some have significantly changed. Some methodologies have had to. Are the principles of research integrity the same? Are they changed for some reason, or is there a different emphasis? You'll note that the Australian Code didn't sort them alphabetically. Is there an intrinsic order to having honesty first? Is that still first? This is kind of also true of the principles of human research ethics. Beneficence, does that take precedence now over other ones, such as respect? Just a question. Challenges for ensuring, so for us as a researchers, as a community of researchers, of scholars, of individuals, also this sort of challenge for institutions, and also funding agencies and others, particularly perhaps publishers, editors being very interested in being number one, being first. And then understanding these, how might we solve these challenges? So it did take some time. We had to see what was happening, particularly, for example, in publication. These could have been predictable, but we've taken a little bit of time. One thing we did was, after a bit of time, was to ask these questions of great people at RMIT, RMIT researchers who are part of our Research Integrity Advisor Network. They're listed here: Andy Greentree, Kat Gomez, and Alan Mauler. And then we asked the rest of the network, but these people in particular sort of becoming the brains trust, really, of responsible research integrity at RMIT. We asked them some questions, asked them just basic ones: what's happening? What challenges are you facing? How might that affect then integrity in research? We asked experts in research management, integrity and ethics. Our group in particular was rapidly produced really great guidance notes for research involving animals, so the care and use of animals, animal ethics and welfare, and particularly for human research ethics, because very practical aspects of human research ethics and research with humans and human participants had to change dramatically given the physical distancing and other restrictions that were put in place to limit the spread of COVID-19. And then we asked experts in graduate research based in, and particularly around supervision, supervisory teams, challenges there, and also in research data. To support these questions, we've also generated a series of mini interviews, of very, very short interviews. We've named them RITE BITES. They're named after our education and training program called RITE, Research Integrity Training and Education. And the bites just happened. They're short. They're 5 minutes or less. We're canvassing a range of topics, taking advantage of the situation we're in, where we can remotely record interviews fairly simply now that everyone is at home using Teams or otherwise. And we've been able to talk to, obviously, great people at RMIT and also people overseas, experts in research integrity from elsewhere. And we've asked at least a set of these experts, what are the challenges for research integrity during the COVID-19 pandemic? And they had some great ideas. Some of them were very honest, and they said, well, I don't really know. Well, they said, oh, look, I thought nothing would change, but then I think something has changed. And these things include the idea that the principles of research integrity remain sort of unchanged and really, really crucial still. But that there's actually a gap. There's actually a gap in instructional information guidance for researchers, for institutions as well, but particularly for researchers to do research that's trustworthy and responsible. Very quickly, for RMIT researchers that we asked, there are communication challenges for supervisory teams and challenges in relationships, very, very human things. Think about well-being, but also that imperfect nature of remote communication, video, working, doing like this, talking with you over Teams instead of being in a room with you, and that the dangers then, or the risks of missing cues. There's a lack of spontaneous interactions. So this urgency of getting research done and quickly out to people. The idea of not spending time thinking about either the procedures that support research, or even when you're doing it. So there's lack of thinking about ethics, perhaps. The over-enthusiastic rush to produce writing, peer review and publish, this idea of lack of rigor in rapid research, despite an increased need for transparency and quick communication. There's also this very interesting topics around pressure and unwellness and the politicization of research, this seeming war against pseudoscience that research integrity seems to be interfacing with a little bit. Clearly, when we look at the mechanisms that we know affect the translation of principles into practice, the COVID-19 pandemic has changed the research environment very much so, and has introduced new stressors. So essentially what it's happened is if we look at this spectrum, this representing variation into practice. Maybe the boundaries have shifted. Maybe some questionable research practices are going to be more frequent now. Breaches might be more frequent because people are rushing. Maybe, perhaps. Speaking with experts and others, then and specialists, things that stand out are challenging, include not following ethics approvals, particularly given that there are new conditions or requirements given physical distancing and other restrictions. Obviously, in the interviews, there's this concern around flawed design. So, inappropriate not only design or application of certain methodologies, but also flawed reporting, like particularly when you're quickly rushing to report and putting it on a preprint server. Always mismanagement is always a challenge, and so is inadequate supervision. And these seem to be challenged in the new ways of doing research. And of course, the big three are always an issue and appear to have been an issue early on, where perhaps journals were too keen to take up research that was flawed, not necessarily through error, but perhaps through people intentionally making up research or falsifying data around vaccine development. It's certainly been documented, and there have been retractions or things seen in the literature to correct for this already. So again, a moment just to pause. After that, Sam, if there's any questions arising.
Yes, we've got a couple that have come into the chat. Nicholas Smale has asked, have there been any known breaches of research integrity at RMIT or elsewhere for which COVID-19 related matters were a major contributing factor to the breach, i.e. people falsifying results or being sloppy because it's not easy for them to get into a lab?
That's a great question, and one that's really, really hard to answer because Australian institutions are very, very shy about this. Other institutions in other jurisdictions are much more open and transparent about reporting breaches and the very specific characteristics around this. And while we certainly do report on numbers of breaches and certain we put them in certain categories, that reporting is still limited, and for certain aspects of the university. I wouldn't say that we have necessarily seen that yet. And what's interesting is that the most obvious things that have occurred with serious breaches of research integrity for COVID-19 have occurred appear to have occurred in industry, where private commercial research endeavors that then are looking at vaccine development, publishing research, and we find out that it's flawed, fundamentally flawed, for example, and not valid or invalid. So the Australian Code, for example, doesn't apply necessarily to those settings, but the principle certainly should.
Okay, and yeah, thanks for that. And we've also got a query from Laura saying, are there any particular independent people or processes to discuss concerning experiences confidentially? Has RMIT conducted surveys about their researchers' experiences with integrity?
So the first answer, yes. The Research Integrity Advisor Network at RMIT is available and provides advice to all researchers, the research community, if you have concerns around the conduct of research. You can certainly access them. Australia-wide, there's a deficiency. We haven't come together as a community of practice to organise ourselves as well as some other places. to provide what you'd say, oh, that's really truly an ombudsman thing, for ombudsman advisory service for all of Australia. But I think the research community, if you wished, you could probably seek out very well established researchers who might be able to help you, or research integrity advisors at other institutions who might be able to assist as well. The other question was around, Sam, remind me, sorry, not RIAs, it was around
or just if RMIT specifically has conducted surveys about researchers' experiences with
great.
integrity.
We did a research integrity climate survey in 2018, probably the one of the first of its kind in Australia, we think, that developed information for us, finally an evidence base for us to target certain preventative measures or things that are good ideas for the institution. National building and awareness of research integrity issues, certainly at the research leadership level at the university. We're looking to do another one in the current setting, noting that everyone's under a lot of pressure, and it's a pretty stressful time. But that's a great question. There's not a lot of evidence about those sort of issues.
Yeah, and I'll pop a link to your the researcher integrity page with the email to speak to, if you wanted to speak to an advisor, in comments as well.
Great, thank you. Thanks a lot for the questions. Thank you. So here's a set of solutions. Actually, probably they're more good ideas. We probably really, if we're being frank, we probably really don't know what works in terms of preventing breaches, or really enhancing or enabling research integrity. To be really transparent, there's not enough evidence or research-based look at what works and what doesn't. There are some things we know that work pretty well, but otherwise they're just good ideas. But they're good ideas worth trying. One thing that was obvious, that there was a gap in terms of guidance or information for researchers, and so we developed, using the group of people, the wonderful group of people I listed earlier, to acknowledge them. We developed a guidance for RMIT researchers and potentially other stakeholders around these issues. This guidance describes new practices and resources, particularly around trying to meet the Australian Code during the COVID-19 pandemic. It's available through the research portal, but also on Figshare. So it's opened and shared through there, and you can search RMIT Figshare for, well, there's a link there anyway that I'm hoping the slides will be able to be shared afterwards. It'll be no problem. One of the first things is that it acknowledges that the governance of research integrity hasn't changed. The principles remain the same. And here's the Australian Code. The Australian Code's very interesting. It took a lead from the Singapore statement, something that research integrity on a page developed from specialists, experts, interested people involved in an international conference series in 2010, and so it's quite concise. It's essentially 3 pages of essential information for researchers around what are the principles, what are the responsibilities of institutions, and then what are the responsibilities of researchers in all the different things they do to conduct research, from complying with or adhering with laws to following ethics approvals to doing authorship, looking after data, or responding to when they think something's gone wrong. 3 pages is concise, very kind of in a nutshell, very easy to read. And then so because of this concision, it's supported by a variety of guides on particular topics like data management or authorship or supervision, which provide more information. You can get these from the NHMRC website. And noting that they're not changed, we maybe suggest that these are now more important than ever before, these principles and responsibilities. One thing that's clear is if you can do research, if you're part of the system that require, you've got arguments for coming in physically to the campus, for example, for RMIT Group, I'm talking about Melbourne campus, so just to acknowledge that as well. But you should be conducting what you can call COVID safe research, and that's essentially research that takes in mind and puts in place the necessary steps according to RMIT's COVID safe plan. And so there's There's a link there, but there's a link in the guidance. The guidance called that out initially. It's the most specific COVID-19 action for researchers. There's a big thing, right? So when this all happened and we had to change not coming in, for example, under restrictions, or even the restrictions we're under again now, many researchers have had to change research direction. For some researchers, this is a great opportunity. For others, it's more of a challenge than an opportunity. It's quite difficult. How do you do this? How do you reconcile this? What happens if you don't want to do COVID-19 research? You know, these sort of issues, these sort of worries, which are perfectly reasonable. Particularly for research that already had research ethics approvals in place, this was particularly a challenge. And so that's why our team had already established guidance notes on human research ethics and animal research ethics during the COVID-19 pandemic before we developed the research integrity one. There were already mandates coming out of the NHMRC and elsewhere around, well, what are the conditions or the restrictions now for doing human research, for example, or animal research. So I recommend checking these out in the researcher portal or speaking to the team that we have for advice. There's also then, in the changed environment that we're working in, I guess maybe the call out that procedural ethics and ethics in practice are different but linked, and they're both very important. Getting and maintaining an ethics approval, you know, these things speak to that. Procedural ethics, applying and getting an ethics approval, you know, sometimes it seems to encourage responses from researchers that we know that will get approved by a committee. Really what they're aiming to do here is to encourage the incorporation of the principles of ethics into our research projects and to improve them. Obviously, this mechanism can't hope to capture all the ethical risk that exists. So then in our changed settings, I think it's good to be mindful of the idea of being faced with moments of ethics and integrity as a researcher. There's decisions on the fly that might not be big issues, but might nonetheless have consequences and might be important. The thing about these is that you can't predict them, so you've got to be ready. And I think this is coming out of work from Gladys Gilliman and Lynn Gillam at the University of Melbourne. They suggest that the researcher should constantly take stock of their actions and their role in the research process and subject those to the same critical scrutiny as the rest of the data. So essentially what they're suggesting is being, as a researcher, being reflexive to ethics and integrity moments as you're doing your research. With the rapid or explosion, this interest, people pivoting and then really getting into research to research the various aspects of the COVID-19 pandemic, there is this call out, this issue with the compromises to rigor, robustness, and challenges to reproducibility. There are requirements for researchers at RMIT, according to the Australian Code, around rigor and, you know, producing valid, reproducible research. Excuse me. How can you do this? This is actually a broad challenge that we're faced with, but in the COVID-19 settings, then it's a good call out to the Equator network of reporting guidelines. So understanding reporting guidelines at the start, so how disciplines and publishers expect research to be reported, what's going to be communicated at the end, can actually help at the very start. So there's a reference to them, but also a growing idea of open research practices, and in particular, the idea of registering what you're going to do, your plans, before you even start. So enabling peer review of research, peer review of your methodologies before you undertake them. For some disciplines, for some researchers, this has proved very, very helpful. In other disciplines, this is not a thing yet, but it's supported particularly by people at the Open Science Framework and other researchers around this rapid registered reports, and there's a link there. You could certainly have a look at it, and I suggest that this is a really great resource. This is a resource from the Open Science Framework or the Centre for Open Science, and looking at open and reproducible research on the Open Science Framework. How would you go about it? It's in a current protocols journal, so it's very stepwise, very detailed in how you actually might meet and use the tool, meet the conditions of open and reproducible research by using these tools, and particularly around research data management. There is a call out and an issue around responsible dissemination and sharing. Obviously, there is already a requirement within the Australian Code to disseminate research findings responsibly, accurately, and broadly, but also in COVID-19 settings. So if you're looking at COVID-19 research data, the rapid and open sharing of that data is supported by global funders and by publishers. And so there are mandates, for example, or things, statements that these groups such as Wellcome and Trust and others have agreed to around the settings for open and rapid sharing. Obviously, please consider these in the context of IP, but COVID-19 research data and research during an epidemic or pandemic of this size has different, perhaps, conditions. And this is a shout out to our university installation of FigShare, a great platform for openly research data and findings, a great way of publishing your data to potentially get more citations, but really to broaden the impact and disseminate your work. Research data management is always an issue. The responsible research data management is always an issue, a persistent one. And so really this is just our guidance note or our guidance coming out from this COVID-19 work, re-emphasising that research data management plans are probably a good idea. You probably should do them and look at them and use them. And if you're supervising students, do that as a supervisor, do it as a team. Do it with, share the responsibility for responsible research data management. But there actually are also specific guidelines if you're doing COVID-19 research, and also specific resources that are now freely available, such as the ones provided by Springer Nature. And this idea of research data management is a persistent issue that, in research integrity and responsible research, that's continuing and maybe amplified or enhanced as an issue during COVID-19. Is the same for, I think, for supervisory teams. So the challenge of inadequate supervision, which is one of these questionable research practices that appear to be more important to prevent or to solve for, as compared to, for example, researchers falsifying data. So this publication here from these researchers did a survey of specialists and experts in research integrity, and these questionable research practices such as inadequate supervision or poor record keeping appear much more important for the integrity of research to solve for as compared to plagiarism or fabrication. And they've continued this work with researchers across where they're based in the Netherlands, and they've looked at it by discipline type, and insufficient supervision is the sort of the number one research, we call it researcher misbehaviors, that would be good to solve for to improve the trustworthiness of research. So I call out an important call out to how challenging remote collaboration, particularly supervision, and particularly for graduate researchers, how hard it is for supervisory teams with all these challenges listed here, and in particular support for both supervisors and trainees. Here are a list of resources. I hope many of you, if you're in those settings, have already accessed these. There's increasing number of them from SGR and from other places within RMIT. Particularly call out the publication around supporting belonging and well-being for HDR students. So that's a call out from there. And finally, using trusted research resources for data. And I guess we have to do it this way, remote working and working due to physical distancing restrictions and other things. A chance now for most researchers at RMIT, because it probably will work fine for them, is using CloudStore. It's a Dropbox-like storage for all researchers at RMIT, at least a terabyte, perhaps in combination with RMIT resources such as Office 365. This is a good solution for most, not all, but most. And again, if you need more information, there is some information there. So to briefly summarize, research integrity underpins trustworthiness and impact. The principles, we've talked about them a lot, and they start with and include honesty, and then others from there, including rigor and transparency. And some of these appear to be emphasized during the COVID-19 pandemic. We're beginning to understand this. the COVID-19 pandemic has changed the research environment for all of us, and yet the expectation that research will be done in a trustworthy, responsible, ethical way, that hasn't changed, and nor should it. So planning a research perhaps now, even through the basics such as authorship, publication planning, data management planning, perhaps more important now than ever to document these things working remotely, but also the idea of being willing to reflect on your research as you're doing it. And a question that's constant: how will you meet the principles of the Australian Code for your research? A constant one for researchers, particularly for researchers affected by the pandemic, and particularly for their research. Here are 5 things that are around about the changes, things that are changed. You should be implementing a COVID safe plan in order to do your work safely. There are conditions that have changed for ethics approvals. Please plan and practice responsible management, sharing and reuse of your data and findings. Consider the new ways of ensuring rigor, such as using open research practices and various resources for graduates. Sam mentioned this earlier, but the research integrity advisors are here to help. There's about 30 of them across RMIT now. Please access them if you have a question about research integrity. They'll be able to provide some advice. Here's my acknowledgements for this presentation, and in particular, David Blades. And well, thank you, good luck, and stay safe, and don't hesitate to contact me. And thank you very much, Sam.
Yes, thanks, Daniel. That's excellent. And as I said in the chat and beforehand, we'll make a recording available to all participants and post on the Library Research Spotlight YouTube channel. So we'll share that more broadly on Yammer and so on, and we'll also get Daniel's slides shared with that as well. So yeah, thanks everyone for attending, and much appreciated, and stay safe.